Hi, ladies, and welcome to week 4. We're already halfway through the course. Week 4 is about an ethical case study. Our competencies are to identify and explore 2 laws that protect patient privacy, describe the implementation process of one of the privacy laws in a healthcare setting, explain how ethical behavior of a healthcare provider influences the quality of care given to consumers, and differentiate between the law and ethics in resolving a healthcare case study. Our discussion is to research and discuss 2 laws that protect patient privacy and explore how they might relate to ethical behavior. And then please share an example of how these laws can be implemented and carried out in healthcare. Do you think that they really enhance patient privacy? So in our McWay book, in our ethics chapter, they talk somewhat about some of the privacy laws. But if you look back into the chapter 3, which goes over legal issues in healthcare, they talk a little bit more about HIPAA and the High-Tech Health Information Technology for Economic and Clinical Health Act. And there are also some federal and state privacy laws that require healthcare providers to obtain patients' written consent before they disclose their health information. A lot of these privacy laws have to do with sensitive information such as mental health, substance abuse, and family planning. Our assignment is a debate about pregnancy in a teen. And you are going to defend the teen's request or dispute her request. It's your choice. It's going to be a full 3-page insight paper with research. The patient is 15. She arrives at the doctor's office frantic, certain that she's pregnant. She doesn't want her mother informed. The result of her pregnancy test confirms that she is pregnant. She's requested an abortion and again states that she does not want her mother informed. The doctor has offered to mediate between the daughter and mother. Discuss the law and the ethical implications in this scenario. Explain how ethical behavior of a healthcare provider can influence the quality of care given to consumers. Identify challenges and barriers. Support the debate with laws, facts, and credible resources. This is very important. No matter which side you choose, you probably will have strong feelings about it. Make sure that you disclose what state you're in and which state laws you're referring to, because they're different from state to state when it has to do with a minor. So support that you're siding with laws, facts, and credible resources. This is just an example of some of the states, and it's old now from 2013, how states differ. Some they need consent, some they need notification of the parent and consent, and some there's no parental involvement needed at all. So again, if you have any questions about this week's assignments or discussions or any of the content, please email me and let me know. And I will be seeing you online. Bye.